Necessity, the saying goes, is the mother of inventions, and this is, according to some GPs, necessary. Face masks to protect against coronavirus. 3D printers are used to make the bands, and in this case water bottles, but it could be something similar, to make the shield.
There was concern from both practice staff and staff across the whole of the primary care network that actually they would quite like something like some face protection or eye protection, which isn't issued as standard. So rather than trying to deplete hospital supply chains.
This cottage industry has led to 10,000 orders so far. Despite photo calls with boxes of gloves and the army called in to deliver supplies, NHS leaders remain deeply concerned about the lack of protective equipment. The Royal College of Nursing told us that in a meeting with the Health Minister this afternoon, they were assured that it is being distributed, but the college warned they would be holding the government to account.
I'm hearing from my members that certain hospitals are bending the rules in terms of what they're asking them to wear when they're dealing with COVID-19 patients. I want to make it very, very clear that nurses should be able to have fluid repellent masks on. They should have aprons and gloves if they are working within 1 metre of a patient. And most nurses will be working within 1 metre because they are delivering personal care. They also need to have eye protection if there is a danger of splashing. If nurses aren't safe, then they won't be delivering the care that is needed by the patients and people of this country.
The government says that 50 million masks have been delivered across England in the past 2 days, along with more than 24 million gloves and 1.4 million eye protectors, which sounds a lot, but there are 1.3 million staff in England's NHS. COVID-19 is virulent, and every day the numbers infected are growing. 570 people were, as of last night, in intensive care units in London alone. And there are growing staff shortages. A cardiologist showed us masks he has now bought before returning to work. He has spent a week recovering from COVID, possibly caught from a patient who he believes caught it in the hospital.
That patient didn't make it, and she goes down as one of these people described as elderly with underlying health conditions, but she should have lived to 90. If we want to keep our people safe and keep their patients safe from them, we need to be doing the most intense protection that is feasible in the course of a working day.
This isn't just a story about protection, though. It is also about testing. And today, the British Medical Association described the government's approach as illogical.
We had situations where many GP practices and hospitals were understaffed. The staff themselves who were self-isolating were telling us they felt able to work, many of them felt able to work, but were following the guidance. If they were able to be tested, they would come back to work. Now, we made that point right at the outset, and it just seems counterintuitive that we are reducing our workforce at a time when we need it the most.
The drug company Roche Diagnostics has confirmed to Channel 4 News that it has struck a deal with the government to increase coronavirus testing. Automatic machines are now being used in 2 NHS trusts. Public Health England has said it will provide an extra 5,000 tests a day by mid-April. And the government has promised, at least in the short term, to reach 25,000 a day.
And Victoria is with me now. Now, we've seen a large rise in the number of reported deaths, but it's not quite as straightforward as that, is it? Because there's been some confusion about what was being reported.
So yesterday we saw 43 deaths, which is 43 too many, but we were quite surprised how low that figure was because it didn't fit the trajectory. What they have done is they have changed the reporting system for what seem eminently sensible reasons. It's because they need to take into account having to tell the families. They need to take into account the time it takes to tell coroners. They need to do more testing. Mostly as well, they want to reduce the staff time spent filling in the form. So what they've done is they've changed the testing, they changed the reporting so that it went from 9 a.m. to 5 p.m. yesterday, which was essentially a half-day figure. Now it will go from 5 p.m. for 24 hours, so we'll get a fuller figure. Now, the fact is that in China we saw a whole lot of changes in reporting as systems adapt, and that is what the NHS is doing now.
Thanks, Victoria. Now, they may be better known for making vacuum cleaners, but James Dyson's company is now being asked to make ventilators for the NHS. The UK currently has 8,000 ventilators, but needs 30,000 to cope with the coronavirus pandemic. The government says it's doing everything it can to procure more, like asking Dyson to make.
As the virus spreads and growing numbers fall seriously ill, there's an urgent push to get life-saving ventilators. Ministers have acknowledged the UK needs tens of thousands more to prepare for the peak of the pandemic. A recent report from Imperial College showed that at least 30% of coronavirus cases will require mechanical ventilators.
We want anybody who has the manufacturing capability to turn to manufacture ventilators to do that.
But after the Health Minister Matt Hancock recently put out a call for help from British manufacturers, there has been confusion over ventilator numbers in the NHS and government plans to procure more. It's estimated a minimum of 30,000 ventilators will be needed to cope with an upsurge in COVID-19 patients. There are officially just over 8,000 currently available in the UK. 8,000 more have been ordered from existing UK and international manufacturers. The problem is, ordered doesn't mean received. Although some may be available within weeks, others may still be months away.
Allow me to present the Oxvent. This system takes in standard 4-bar air.
Among those responding to the government's call, a team of scientists at Oxford University who've come up with this, Oxvent, a simple ventilator prototype using off-the-shelf parts.
The design is very, very simple, and so it could be made immediately. The parts that it does have in it are already in the NHS supply chain. They're already there. They're just being repurposed. It's simple, it's safe, and it's very scalable.
But they aren't the only ones to have stepped up. Industry titan James Dyson, moving from vacuums to ventilators, said he had received an order of 10,000 units from the UK government. An announcement slightly tempered when the government said today they were still in the testing phase and Dyson's design, like any others, still needed to pass safety tests. Dyson are confident they can deliver such a large order and meet all the safety requirements. But there are some concerns about the ability of companies like Dyson to suddenly switch their production and make complex ventilators on a mass scale.
Really, if you want to produce things in mass numbers very quickly, it just has to be very simple and only just good enough to do the job. It doesn't need to be any better than that. In 3 weeks' time, we may not need them anymore. We will have had time to develop more sophisticated devices, but we need something to plug this surge gap in the next 2 or 3 weeks, otherwise we're going to be in trouble.
While large-scale production of ventilators in the UK still appears some way off, the government claimed today that because of a mix-up, it missed an email from the EU about ventilator procurement, but said it would consider joining future rounds. Opposition MPs accuse the government of putting ideology over people's lives.
We need ventilators to save lives, and it would be extraordinary, unacceptable, and quite wrong if the government were putting ideology before saving those lives. That ideology being that because we are leaving the European Union, we're not taking part in a scheme that the European Union have invited us to take part in. We need those ventilators.
The government insisted it was an honest mistake, nothing to do with ideology, but it will struggle to justify any decisions that may cause delays in getting vital ventilators to those who'll desperately need them in the coming weeks.
Well, joining me now via the internet is Saffron Caudry, who's Deputy Chief Executive of NHS Providers, the Association for Health Trusts in England. And your colleague, the Chief Executive, this morning will have set a lot of alarms going when he used the phrase tsunami of cases with regard to London hospitals. Can you explain what that means?
What he was talking about was the fact that we've heard from hospital chief executives in London that they are seeing wave upon wave of seriously ill patients. And I think that that is what he was referring to. So people coming in with suspected coronavirus needing very high levels of care, seeing it on a level that appeared to be unimaginable.
And in terms of equipment and personal protective equipment, what's the current situation?
So what Trust chief execs are telling us is that they really need some clarity on the equipment arrangements. What we are seeing is a change in the guidelines from Public Health England, and we need them to explain those changes. They may well be the right ones, but staff on the front line need to see those explained. They need to see the evidence behind it so that they can feel safe. In terms of the supply of equipment, we think that that's got better. That's certainly the reports that we're hearing. The logistical distribution has improved. It's being pushed out to the front line. There are still problems, there are still frustrations, but more of that is coming through. But I think it's this clarity around the safety standards that are being prescribed on the equipment.
Where are you up to in terms of the capacity of the ventilators that we have, which we now know is 8,000, not the 12,000 that the Health Secretary spoke about at one time? And also whether those ventilators can be used for more than one patient at a time, as some people have suggested.
I don't know the full details on the ventilator capacity. I think overall what we know is that we really need immediately and then over time, because we're in this is a marathon, not a sprint, as so many people have said. We need that capacity and we need it on an ongoing basis. So we know that the Nightingale Hospital is due to be up and running, I think, next week with 500 beds, but we're not clear yet how the ventilator capacity is going to be filled for that. So we know that that's being nationally procured, that doesn't come locally, and that all of those supplies will go into that hospital. But I think the important thing here is what's being done by trusts up and down the country to create as much capacity as possible. They have done in such a short period of time what we wouldn't ever have expected them to be able to do, discharging patients, getting bed occupancy levels down to below 80%, some really amazing work being done in order to manage this wave of patients that is coming. So much is being done, but we can't predict how this is going to pan out. And I think in terms of the ventilators, it's just as many as we can get as quickly as possible. But I think the picture there isn't clear. But what we do need clarity on is when the protective equipment will come, and also when testing will be widespread, as the earlier speakers in your piece said.
Yeah, I mean, you raised testing. I mean, this is the thing that NHS staff have been saying all the time. Is it any clearer today when they are going to get access to testing?
It's not clear yet. We're asking for clarity by the end of tomorrow, because it's absolutely critical, because we've got staff who are off sick with symptoms. They may not be coronavirus symptoms and may be able to come back to work earlier. We have staff who are self-isolating, and that means on some occasions they can't come back for 2 weeks. They're incredibly frustrated. Hospital chief executives are frustrated. We need to see that testing both for patients. It's important we continue to test patients. We need to know what they're sick with and how they should be treated. But it's also critical that we understand that staff need testing too, because we've got upwards of 20 to 30% sickness rates or absence rates across the NHS. And we were already down 100,000 staff, with staff very tired before this began. So, it's a really urgent situation, and we would just urge the government and the national organisations to come forward with clarity on that testing as soon as possible.
I mean, yesterday, the scientists were saying that the next 2 weeks are the period over which this is going to grow. If we are already at 20 to 30% staff absence in hospitals now, and we don't have access to testing for several days, that's going to get to really alarming levels quite quickly, isn't it?
We're already concerned about staffing levels, and it is a concerning picture. I think we have to remember we're doing everything we can. Trust chief executives are doing everything they can in order to source staff from elsewhere. We've had this big national call for retired staff to come back in. Often they won't be going to frontline roles, but they'll be freeing others who can be redeployed. That's really, really important. 15,000 people have responded to that call. That's really encouraging. And we also know that the independent sector capacity is going to be used in order to help this. So lots is being done, but yes, those staff absence rates are what we need to tackle with the testing, and that's why the testing can't come soon enough.
Saffron Caudry, thank you very much indeed.